Welcome back to the FemStrong podcast, guys. I'm your host, Stacey Riccolo. In today's interview, I got to talk to Dr. Rebecca Maidansky, who is the owner and pelvic floor physical therapist, one of the pelvic floor physical therapists at Ladybird PT here in Austin, Texas. Dr. Rebecca is a killer resource, and today we talk about common aches and pains that women experience during pregnancy, things like round ligament pain, SI joint pain, and pubic symphysis pain. We get into it. We also talk about diastasis, what it is, do we need to worry about it, is my pain coming from there? We dive into where these things are coming from, what we can do about them, where we solve for the root cause, and how we can manage the symptoms throughout pregnancy and work around these things to keep moving in ways that support us during this season. Dr. Rebecca is truly so great at explaining things. She is a wealth of knowledge, and I'm stoked for you guys to hear this one. She's amazing. This episode is killer. If you are in the Austin area, I want to make sure that you know I'm doing a community event every final Friday at East Austin Jiu-Jitsu Parlor, which is where I'm currently coaching and taking my in-person clients. At FemStrong Fridays, we're doing a lift together where you're going to get to learn some lifting technique coached by me. And then we're going to do a learn. So we're going to be talking about things like pelvic floor during exercise, core strength throughout pregnancy, exercise considerations throughout pregnancy. It's just going to be a good time. We're going to get a lift. We're going to get to learn, and then we're going to get to hang out with some like-minded women. So if that's something you're interested in, you can go to my website, www.femstrong.co, go to events, and sign up, snag a ticket. All right, let's get to the show. Here's Dr. Rebecca. Welcome to the FemStrong podcast, Becky.
Thank you so much for having me, Stacey.
Yeah, thanks for coming on. I'm excited to get into these topics because I feel like these are the things that frequently come up with my friends, and they're asking me like, this is happening, what do I do? And I'm always having to reach out and ask. So it'll be really great to have them all in one place. So I'm stoked to get into it. So before we dive in, how about you just do a quick introduction of yourself. Tell me about Ladybird Physical Therapy and what you do.
Great. Yeah, my name is Dr. Rebecca Maidansky. I am a pelvic floor physical therapist. I'm the owner of Ladybird PT, which is a clinic that specializes in reproductive health. So we really work conception to menopause, but our bread and butter is helping people manage pregnancy pains, prepare for birth, and recover postpartum.
Beautiful. That's great. How long have you been doing that work?
So I have been a physical therapist for, I should know the answer to that question off the top of my head, 8 years, and I have been doing this the whole time. Ladybird is 6.5 years old, and our clinic director is the one who trained me in pelvic health when I first graduated. So we have a pretty experienced team, and this has been my entire career.
Yeah, that's amazing. That's so good. And I started following you back when I lived in Reno, Nevada, because a client of mine lived out here. So I asked my pelvic floor PT friend back in Reno where I should recommend that she go, and she mentioned you guys. So
amazing. That's so cool.
Truly, yeah. And you guys are fantastic. I've been very glad to be connected with you. And when I got out here, I didn't realize, like, geographically, I didn't know what Ladybird was. I just thought it was like a really cute name for your clinic, you know? I was like, what a fun little, like, Ladybird, like a fun little name for
a random choice.
For a women's PT clinic, right? I love it. And so when I got out, I would refer to you guys as Ladybird as I was like talking to people. And I finally figured out, people were like, what do you mean? Like that could mean a lot of things. And I was like, to me, like, you guys are Ladybird.
Yeah, I mean, I'm sure your listeners are not all in Austin, considering that you just moved here. But it's so funny when I was talking to my boyfriend at the time, not my husband, about names for the clinic, and a few of my friends, we were throwing out names, and they were all Austin based, and we were doing all sorts of, like, I don't know, just kind of like basic run of the mill names. None of them stuck. Somebody said Ladybird PT. And we were like, oh my gosh, that's it. And we surveyed all of our local friends, and everyone was like, that's it. That's the name. And then I texted it to like a few of my closest friends outside of the city, and they were like, the movie? It's like, no.
There's a movie?
There's a movie called Ladybird, and it's like a coming of age story about a girl. And I just pretend that isn't a problem for people outside of the city, because I think Austin gets it. But for anybody not from here, it's Ladybird Johnson is our namesake.
Yeah. I had no idea there was a movie.
Yeah. Perfect. Honestly,
and
great.
Perfect. Yeah. And living outside of Austin, I also didn't know about Ladybird Lake. So I
Right.
didn't realize that Ladybird was such a,
Or Lady Bird Johnson. Like, people don't, I don't think she's a figure for people outside of Texas, really, unless they're
no.
history buffs, which many of us are not.
Right. No. Yeah. Fun fact, even living here, I'm not aware. So now I'm curious about Ladybird Johnson.
Lady Bird Johnson was Lyndon B. Johnson's wife, and she was a badass who did a lot of really cool things while he was in office. And she was also responsible for the beautification of Texas highways, and she managed, I want to say, his like media station while he was away. She was just like a very cool, capable person, and that's why there's a lot of stuff named after her in Austin. But she, when she was alive, did not want Town Lake named after her. And then my understanding is she passed away, and Austin was like, sorry. So I don't think she'd be thrilled to know that this is the case, but she is pretty cool.
That's incredible. Oh, well, this is amazing. Well, I'm glad. I'm now
That
learned a
is
little
it.
bit
I know
more.
we weren't here for Austin history, but
I'm here for it either way. Amazing. Well, thank you. Super cool. So yeah, let's dive into some of what we're here to talk about, which is common aches and pains during pregnancy,
Sounds great.
which you help women with all the time.
Yes.
What are the top ones that come to mind for you? Like when I say that, what are the first ones that spring up for you?
Yeah, I mean, we see people for primarily bladder, bowel, sexual dysfunction, and pain. So it's all within that category. Urinary incontinence is one of the most common things that we see during pregnancy and postpartum. Pain with sex is something that can pop up during pregnancy and postpartum. But when we talk about pregnancy specific aches, pains, concerns, we see a lot of SI joint pain, pubic symphysis pain, low back, hip pain. And then a lot of what we do is help people prepare for birth. So a lot of, I'm just really scared. How do I know how to push? What can I do to set my body up for birth? What can I do to set my body up for recovery?
Amazing. Okay, great. So the ones that like pop to mind for me that friends have dealt with are round ligament pain, specifically pubic symphysis, and the SI sciatica pain. So I kind of want to dive into those and go over each of them and kind of talk about where they're coming from, kind of what's happening mechanically speaking,
Yeah.
and then what women can do about them. Either like what the route looks like for solving the root cause and then kind of management of symptoms.
Totally. I think that sounds great. So much of pregnancy and all of the things that you just described are a combination of there are so many mechanical changes happening to a pregnant body. And a lot of those things go away once baby is born, but a lot of them don't. And so there's this belief, and I still hear it from people, it's like, I'm just going to wait it out, which can work. Like for some people, for some conditions, it does work. And for other people and for other conditions, it doesn't. And so I'm pumped to talk about all of them. I think it sounds great.
Amazing. That sounds good. Cool. Well, let's dive into round ligament pain first then.
Yeah.
What is it and what can we do about it?
Yeah, so round ligament pain, I'll talk about what it is and then what it feels like. Round ligament pain is, first of all, I think it is blamed, and I think a lot of things are called round ligament pain that aren't. But your round ligament is a ligament that goes from the front of the uterus and attaches into the groin. You have two. There's one on the right and one on the left. So as the uterus grows and the uterus rises up in the body because it's getting bigger, that ligament that goes from the groin to the front of the uterus stretches and becomes under tension. And that can become painful for some people. Round ligament pain usually shows up, if true round ligament pain, like it's actually the ligament, shows up when people go through quick transitional movements. So I get like a stabby pain in my right or left lower abdomen when I stand up, roll around in bed, change positions when I'm sitting, laying, whatever. It happens quickly and then goes away quickly. That's round ligament pain. It's like a sharp stabby, like oof, and then gone.
Okay.
People call all sorts of things round ligament pain now. Like I've heard Braxton Hicks described as round ligament pain. I've heard low back pain described as round ligament pain. So I think it's important for people to keep in mind that this ligament is in the front of the uterus, goes from the low belly, the uterus, to the groin, and that it really is this like quick transient, even though pretty uncomfortable pain.
Got it. So it's more of a sharp stabby. It's not like a dull, achy, persistent, often there pain. It's a quick stabby, sudden movement. Whoa, it's there, then it's gone.
Yes. Yeah. And you know what you did to cause it. Like you moved, it happened, and then it's gone.
Okay, got it. So if it's mysterious, invasive, then it might not be round ligament pain.
Not round ligament pain.
Okay, got it. So that's how women can identify it then, is if it's that sharp, stabby, quick, there it is. What tends to help?
So round ligament pain is one of the rare symptoms in pregnancy that will go away after baby is born.
Cool.
Right? Like,
this one isn't one that's going to stick around.
It's not one that's going to stick around. It's there because your uterus is expanding to accommodate baby that's growing. Once baby is no longer there, pain will go away. So that's one thing that I like people to know, because it can be really distressing, because it is pretty uncomfortable.
Yeah.
One other thing to mention on the symptoms is the reason it can happen right versus left is also baby positioning. Like if baby is all curled up on one side, your ligaments are going to be asymmetrically stressed. So it's normal for it to be asymmetrical. It's normal for it to switch sides. And it doesn't always just get worse as the pregnancy progresses because positioning affects it. But things that people can do actively to reduce pain, there are two really main things that we train people to do. One is if you know there's a movement that triggers it, engage your core before you do the movement. If we know the ligament is causing pain because as you shift positions, the uterus is stressed, the ligament gets pulled, that causes pain. So if you tighten your abdominal wall before doing that, you hug the uterus, you give it a little bit of support, so you get less quick stretch, less quick pain.
Got it. So there's less tension going into the ligament itself because you're creating that tension through the muscle contraction.
Exactly. You're bracing so that organ can't shift as much. So you get a reduction in pain. It's kind of a pain in the ass because you have to do it. You have to remember. Yeah. But it is something that makes a difference. The other couple things that can help, what we do in PT, but I train my patients to do it at home, is your round ligament attaches into the labia majora. And so if you massage the attachment point, like the groin, the labial tissue, you can relax that insertion point, which can allow for a little bit more flexibility and less of a rigid pull. So you can get pain coming down that way. Though I encourage anybody doing that at home to start gently because you can make yourself pretty sore pretty quickly. Those are the two biggest things. It's really strengthening, and then how do we relax the tissue around the uterus and around the round ligament just to allow things to move a little bit more easily.
Got it. Okay. Now, if they do want to go the route of trying the gentle massage, what would be your recommendation for easing into that?
I would say you are going to use thumb and index finger and almost just gently roll the tissue between your thumb and forefinger using really light pressure. It's not a deep tissue massage. You're not looking for more pain, more gain. You're looking for oh, this is a little bit tender. I'm not going to push harder. So no more than 3 out of 10 discomfort, no longer than for, let's say 2 minutes the first time to see how you feel later that day. And then no more than every other day, just so that you're not digging in repeatedly and just making yourself achy.
Beautiful. Got it. Okay. So round ligament pain, starting with, what did you say? Where is the massage happening? Labia majora?
So that's right at labia majora. Yeah. So your round ligament goes from the front of the uterus and then goes through the inguinal canal and attaches as this kind of wide sheath into the labia majora. So that's its path. We can't really massage the top of the uterus, although you can work on the connective tissue around the abdomen. I don't encourage pregnant people to do that at home unless they feel really comfortable. But that is something that people can do, right? That birth workers can do that are comfortable with that type of body work. But they can absolutely massage the attachment point because they're not going to hurt themselves. The worst thing you can do is make yourself too sore.
Okay, so labia majora, if you need more clarity on where that is, you can take a quick Google search.
Google it.
Find out for sure. 3 out of 10 discomfort. Start with 2 minutes, no more than every other day.
No more than every other day for 5 minutes at a time.
Fabulous. And then see how that is impacting things, if it's helping, if it's not. Beautiful. And then creating tension before you move can help.
Yes. Yeah. And then those are kind of your short-term relief, right? If you're looking for something to help you right now, long-term strength training is one of the best things that we can do. Getting stronger through the core, and not just your abdominal muscles, but getting strength through your whole core system so that the uterus has more support as it grows. But that can be hard for plenty of reasons for people. And I know that you preach strength all the time, so we're on the same page there.
Yes, absolutely. Beautiful. All right, sounds good. Anything else on round ligament pain before we shift gears?
I don't think so. I think I'll just repeating what I said before, like it's not guaranteed to get worse as pregnancy progresses. So if you're feeling it early on, people will sometimes start feeling around ligament pain in the first trimester, and it really freaks them out because it's pretty uncomfortable. And there's always this fear that if it starts early, it will get worse. But with this specific symptom, it's not always the case.
Yeah, I think that's really reassuring. I think that especially early in pregnancy, I think a lot of the thinking is this is all only going one direction. It's all only going to get worse. So I think that's super reassuring. Yeah, I'm glad you went back to that. Cool. Okay, so now let's get into pubic symphysis discomfort. What's up here?
SPD, pubic symphysis pain, is so frustrating for people. It can be so incredibly painful, so incredibly debilitating. And people are still so often told by their providers that they should just wait until baby is born and that it'll go away. And this is like, if round ligament pain is like, listen, it'll probably get better. It'll probably get better when baby's born. It'll probably get better as pregnancy progresses and baby changes shape. Like, also, it's pretty easy to manage if you are just consistent with the way that you're managing it. Pubic symphysis pain is not that. Like, it can be extremely painful. It can get worse as pregnancy progresses. It can start earlier in a subsequent pregnancy than it can the first time. And it can be really difficult to treat in pregnancy. But there is a ton that you can do if you know how to identify it, and also just like listen to your body. I think that athletes in particular are used to like no pain, no gain, push through it. And like I tell people all the time, pubic symphysis pain is not that thing. Listen to it, because if you don't, it will pay you back more than you would like it to.
Okay.
So what SPD pubic symphysis pain feels like is, so
Can I pop in with a question really fast first?
Yeah.
Is this one of those that is more likely to go away after pregnancy, or is it common that it persists?
So research indicates that minor pubic symphysis pain is more likely to persist. More severe pain is more likely to improve but not go away completely. And the reason for that is what's actually happening in the pubic symphysis. Addressing it, the sooner you address it, the sooner it gets better. And I think most likely if you're in severe pain, it will it will improve once baby is born.
But it might not go away completely.
It doesn't always get people, like that's typically not enough to get people to where they want to be, especially if they have really high activity goals. Okay. But there's still a lot that can be done for it. It's not like, well, now you're going to be in pain forever. It's just understanding why it happens and what you can do about it can get you there.
Okay, cool. Can we flip the order? Can we talk about identifying it first? How can a woman know if she's experiencing it?
You mean symptoms?
Yes.
Yeah. So can I use a pelvic model? Like, do people watch?
Well,
yeah, that'd be helpful.
Well, you know what?
I'll also describe it verbally.
That would be good. Yeah. So we'll have the video, but I typically just do audio. But you know what? Maybe today's the day. Maybe this is a good reason. Go for it.
If my verbal description isn't good enough, whoever is listening, Google the pelvis, and I think it'll make a lot more sense. So you have a pelvis, so you have your two hip bones, and then your pelvis is actually made up of 3 separate bones. It's not one bony structure, which I think is what most people imagine when they picture a pelvis. So you have your 2 hip bones. They come together at the front in this joint called your pubic symphysis joint. It's where the 2 pubic rami, pubic bones, come together, and it's a cartilaginous joint. So this is, I know you said describe how people will know. Before I described what.
No, that's totally fine.
But if you're having sharp, stabby pain right at the front of your pelvis, right at the front of your pubic bone, that is where pubic symphysis pain will be. There are a lot of ways that it can refer, and there are a lot of things that can kind of mimic it. So it can be a little bit harder to tell yourself whether you're having really clearly pubic symphysis pain, unless you're presenting in the way I'm about to describe, in which case it is very close to a guarantee. So sharp, stabby pain right at that junction, right at the front of the pubic bone, that happens when you're standing on one leg, going upstairs, rolling over in bed, getting in and out of a car. Those are putting on socks, shoes, pants. Those are all really clear tells that you're having true pubic symphysis pain, because what's happening is you're stepping onto one leg, removing the other support leg, and you're creating friction at that joint.
Got it.
So that is what it will feel like. Sharp, stabby, but unlike round ligament pain, it might not go away.
Okay.
So you'll get a sharp stab when you do something. That sharp stab may improve, but it can stay really sore. And I have early on in my career, I as a PT tend to try to push people to stay as active as possible because I think generally that's best for their health. Pubic symphysis pain is the one thing that I have gotten more and more cautious with over time, because if you flare somebody, it can take a long time for it to come down. And it can be really debilitating. It can go from somebody saying, doing lunges and going up and down stairs is pretty uncomfortable to I cannot get into a comfortable position to sleep, and it can happen fast. So if you're having that sharp, stabby pain when you're doing those things, do not freak out. Keep moving. But if you're working out or you're doing some sort of repetitive activity and you're noticing it consistently and you're noticing it getting worse, I would take that as your yellow flag to stop and reassess.
Amazing. And then my assumption is, as you're saying this, that you would pay attention to what movements are causing it, steer away from those, and it's likely to be single leg type stuff. So maybe instead of a step up or a lunge, you do a wall sit or a squat, something that's keeping the pelvis neutral.
Exactly. I tell people that the method of treatment is twofold. First, you stop doing the things that are pissing the joint off, because if your joint is in pain, if you don't have enough stability around that joint, doing the things that hurt will increase inflammation, will increase pain, will reduce your overall activity, will make you weaker, will make that pain feel worse. So first, we need to modify the activity, which exactly like you said, instead of lunges, can you do a wide leg lunge? That doesn't work. Squat, right? Wall sit, bridges, hip thrusts. There are plenty of ways we can keep people strong without splitting their legs. But the second is then we need to start building up strength and building back into those movements, because we can avoid lunges, but you can't always avoid stairs, right? We can avoid like a suitcase carry, but you might not be able to avoid carrying your toddler. So we need to, while we modify, also keep building back into those things. For some people, we're able to build back into that during pregnancy, and by the time they go into labor, they're actually moving pretty well. For other people, because of the factors behind their pubic symphysis pain, for other people, we're not able to do that. And so we really stay pretty modified throughout the entire pregnancy. And then once baby is born, a lot of factors have changed. We have a little bit more wiggle room to start building back to those tasks that we've been avoiding for a while.
Amazing. Okay, great. And now you mentioned with the round ligament pain that something that is helpful is creating tension in the core and getting active before movement. Is that beneficial here as well?
Totally. I mean, it's a jointy dysfunction that so I think it's helpful to understand why people have pubic symphysis pain, because it helps color all the answers. My short answer is yes.
Let's go for it.
Yeah, absolutely. Strengthening, warming muscles up, activating them before you move should help reduce pain, depending on how severe your pain is and kind of where you are in the SPD span. The reason people develop pubic symphysis pain, everybody wants to blame relaxin, which is the hormone in pregnancy that helps make us bendier. But relaxin peaks in the first trimester, and pubic symphysis pain does not. It peaks in second, third trimester for people typically. So we can't just blame the hormone. It is a factor, but it's a relatively minor one. Bigger factors are the fact that our gait changes. We now have a fetus pushing on the pubic symphysis, so placing load on it from above where it usually doesn't have that. Plus all of the muscles that support the pelvis, like your glutes, your core, your pelvic floor, are all being strained and fatigued. And so we have this joint that moves a little bit more, that's under extra stress, that has less support. So we can't affect the little bit more movement. We can't affect the additional strain from baby, right? That's a positive thing. But we can affect the strength and the movement patterns. And so we can do a lot of stuff during pregnancy to bring the severity down. But how far that will get people varies from person to person because of those other two factors that are still in place until birth. But like we already touched on, not doing anything through pregnancy doesn't typically end up serving people. You see people still in pain postpartum and a lot more frustrated because now they've been in pain for a long time.
Yeah, now they've been in pain for a long time and the light at the end of the tunnel went dark.
and they're not sleeping, and they're taking care of an infant, which requires being in really funky positions for a lot of time. And so it goes from being, well, shoot, I can't work out, to, oh my God, taking care of my baby is really uncomfortable.
Yeah, which is not what we want for them.
Not what we want for them.
Not what we want. Okay, great. So let's get into what we can do to manage pubic symphysis discomfort throughout pregnancy. And yeah, let's go from there.
Yeah. One of the biggest things that I tell people, we've already touched on, it's exactly what you said. If you're having pain with lunging, with step ups, with split squats, with whatever activity, single leg bridges, bring your legs together. Think about keeping legs parallel, and you can use that principle, for exercise, and you can use that principle day to day. For exercise, like we already said, squats, bridges, hip thrusts, wall sits, add weight. You can still train. You can still get stronger, but we're doing that with parallel legs so that we're not stressing that pubic symphysis joint. We also need to include core strengthening. Your pelvis isn't just supported by your glutes and lower body, so modifying helps reduce strain on that joint, but we also need to train your obliques, your rectus abdominis, your transverse abdominis, the other muscles that attach into the pelvis. And then conversely, your pelvic floor, right, from below. Some people with pubic symphysis pain have weakness, so they're getting less support from their pelvic floor. Some people with pubic symphysis pain have pelvic floor tension, so the muscles are tugging on the pubic bone, increasing pain. So what your pelvic floor needs is going to vary a little bit from person to person. Some people really benefit from using a pelvic wand or some sort of internal release, a PT. Other people need strengthening, and that's where the exercises that we've talked about already comes in. But you really want to take a holistic approach to strengthening your core, which includes your abs, your glutes, your pelvic floor, your lumbar stabilizers.
Mm-hmm.
So that's part one. Then we apply that parallel leg theory to everything that causes pain. Again, like the first step of pubic symphysis pain management is reduce the insults, right? Like reduce the insults and the injury, stop throwing salt on that wound. So if you have pain putting on pants or socks, sit down.
Never wear pants again.
Well, you're
No more
going
socks.
commando for the rest of pregnancy, obviously.
Well, we're removing the salt.
You know what? In Austin, that's like not the least. I was
That's a
pregnant
really
in a
good
summer. I wouldn't mind.
Oh my gosh, truly.
But yeah, I mean, sit
You
down.
said sit down. So sit down to put on the pants.
Yes, sit down to put on the pants. Sit down to put on the socks. Sit down to put on the shoes. Like, don't stand on one leg trying to wobble your way into
Perfect.
leggings.
Yeah, so this isn't the opportunity to be like, clearly this is causing a problem. I need to get better at standing on one leg, so I'm going to do it more. No, this is the time to sit, give it a rest, and then don't worry, you'll stand on one leg to put on your socks and shoes again later. Just not right now.
Totally. Because like we want people to be able to live their lives feeling the best that they can during pregnancy. I have never had somebody who's like, my functional goal in this pregnancy, like what I really just want to feel like myself, is to put on socks standing up. Like, no, we don't care. So like, take the wins where we can.
Amen. Yes, so good.
So that's one. That logic is applied to everything. If you have pain getting out of the car, rotate your whole body, bring both legs out of the car before you stand up instead of doing that funky one leg swing. Right. If you have pain rolling over in bed, log roll. Engage your core, keep your knees together, and roll over as a whole instead of this like funky shifting that like we all do and that only
Just
gets
like
more
twist, weeble, wobble, one thing at a time. It all rolls.
Right.
Yeah.
Right. And the reason we do all of that and you try to be really consistent is because I know y'all aren't out there caring about putting on your socks, but you probably are out there caring whether you can go upstairs. And so if we can minimize the injury to that joint, it's not really injury, if we can minimize irritating that joint with all of those activities, then we have more of a chance to actually use it when we want it.
Yeah, amazing. Yeah, I'm kind of visualizing it like it's a cup or a bucket, and it's like that joint can handle this much, has this much capacity before it's irritated to the point where it's making me really, really uncomfortable and miserable. And if I can avoid the little things like putting on my socks and pants and whatnot, then I have more capacity for going up the stairs. And if it does cause some irritation, which it is not unlikely to, then it's not going to fill up the cup. It's not going to cause so much that it's now negatively impacting my quality of life.
100%. That. Exactly.
Okay.
And then the cup gets bigger as we get stronger. Right?
Cool.
So like we get increased capacity, our cup
Beautiful.
increases in size over
Yeah.
time, but in the beginning we have a pretty small cup.
Yes, absolutely. So, yeah, in the beginning, when we first discover it, and we've been doing all of these things that do cause it irritation without realizing, the cup is pretty small because it's already a little irritated. So especially at the beginning, we want to put as little as possible in the cup so that we can make the cup bigger. Okay, wonderful. Enjoying my cup metaphor. Wonderful.
We can just apply that to everything from here on out.
I know, right? I love a good metaphor. Okay, so I want to circle back to what you were talking about with the exercise. You talked about strengthening the core, that the core is more than just our abs. And you talked about kind of two avenues of, we may find with someone experiencing this that strengthening the core is the really helpful route. We may find that some maybe have more tension that's causing the problem, and helping it relax is more of that route.
Yeah.
My assumption is that the ideal way to determine that is to see a pelvic floor physical therapist. However, can we give them kind of like a start here, start there?
Yeah.
How would they maybe check in on what direction might be true for them?
Yeah, of course. I mean, seeing a PT is not always an option for people. And so I think the more people have the ability to assess themselves, the better, even though it's an imperfect, everything's an imperfect system.
Absolutely.
So,
Ain't that the truth?
so I think that the way you described it is correct. And then of course there's the fact that we're real humans with real bodies, and so there are people that have both, right? Like there's the weakness driven, the tension driven, and then there's this little factor in between that's just like day-to-day life. And so most of us actually are kind of a combination of all of it. So I would say like nobody's going to hurt themselves by, well, I take that back. Nobody's pain does not need both strengthening and relaxation. You can absolutely hurt yourself by overdoing anything with pubic symphysis pain, but starting slow, I think most people with pubic symphysis pain would benefit from both approaches. And so they could try this stuff and see what feels good in their bodies. That's, I think, a better approach than trying to figure out, am I tension driven or am I weakness driven, just because it's probably a little bit of both, especially if you've been in pain for a while, because even if your pain was driven by weakness, when we're in pain, we guard and our muscles get tight, and then those muscles tug on these structures that hurt and they're inhibited, so they're weak. So it's this cycle.
Got it. I love
so
that.
What I would tell people that they can do to address tension in the adductors, so the inner thighs and the pelvic floor, often contributes to pubic symphysis pain. So we address that. Right? And we start by addressing it pretty gently, and then we increase the intensity with which we address it. So adductors, addressing adductor tension, one of the easiest and gentlest ways is foam rolling. Foam rolling standing up specifically. So you stand up, you put a foam roller between your thighs, and you gently shift your weight back and forth, assuming that's not triggering your pain, to massage different parts of the inner thighs. You move it up a little bit, down a little bit, so that you work along the whole inner thighs, from knees basically up to groin. If you are squeezing so hard it's causing pubic symphysis pain, that's too hard. And if you're squeezing so hard that it's excruciating, that's too hard. But this is like surprisingly tender for most people. So that is one thing that I would do to start addressing tension. The second, and this one I'm hesitant to tell people on a podcast to do, but I'm going to say it because I think that it's something that can be really helpful for people with pain. I would just encourage you to at least talk to our listeners, to at least talk to their OB or their midwife about it before beginning if they don't have a PT. But the second is a pelvic wand. So using a wand, if you're not seeing a PT, to do internal release. Because pelvic floor muscles that attach into the pubic bone, if they get tight, then it pulls on the pubic symphysis, it can increase pain. So if we use a pelvic wand, which is just a tool that you can insert vaginally, you can massage those muscles that are really tight and tender and help relax the tension on that pubic symphysis joint the same way that adductor foam rolling helps relax the tension on the pubic symphysis joint. Now, there are right and wrong ways to do that, which is why I'm like, if we had a whole podcast dedicated to how to use a pelvic wand in pregnancy, I would feel differently. But just like quick 3 things to know. You never want extreme pain. That's true with everything. I'm going to keep saying it, but like we're not looking for more pain, more gain. You're looking for like 3 out of 10 discomfort. You're working 1 to 2 inches inside the vagina, and you're working really from like 10 o'clock to 2 o'clock. If you picture the vaginal opening as a clock, not from 11 to 1. So not up by the pubic bone, because though that can be really helpful to release, your urethra is there. And with somebody who doesn't know what they're doing with a wand, you can create injury to that tissue, so we don't risk it.
Got it. Okay. Interesting. Okay, so recap, keep it gentle.
Yeah.
If you're going to use the pelvic wand, keep it gentle. Earlier, you said 3 out of 10 discomfort when we're talking about the massage for the pubic symphysis. So on the internal work, same rule. Keep it gentle. I'm getting a notification from my recording app that's talking about hand gestures. It's like, turn on this hand gesture feature. Like, I don't know what you're offering me. It's a feature I'm going to ignore.
No, thank you.
Yeah, no thanks. I don't think I need it. I'll find out in 3 months that it would have been cool. I don't know.
You and me both.
Yeah. All right. So keep it gentle. We're talking topsies, 3 out of 10 discomfort. Nothing that would make you go fabulous. Just enough that's like, this feels a little bit
Productive. Like a little productive.
Things happening. Okay. You said, was it 2 inches?
Yeah, 1 to 2 inches. So we're not ever trying to go deep enough that we're getting close to the cervix.
Fabulous. Okay. So just a little bit in, little bit of discomfort, and only 10 to 2.
Yeah, along
not
the bottom.
11 to 1, along the bottom.
Horseshoe.
Leave a horseshoe opening at the top.
Exactly.
Okay, fabulous. Beautiful. And maybe some other time we can do a whole podcast episode about how to use a pelvic wand during pregnancy.
Deal.
Don't tempt me with a good time. Okay. That sounds great. So for pubic symphysis discomfort, strengthening is going to be like root cause, like strengthening and making sure that we're releasing tension where that is.
Yeah.
There's our general 1,000-foot view. Anything else?
No, so the adductor foam rolling and the pelvic wand are how we start addressing tension-related symptoms. If you're wondering, like, well, what about the weakness?
Perfect.
That's tough because it's really going to depend on the person, right? It really depends on, like, I can't say like these 3 exercises are what's right for everybody, but I can give you like a general idea of what an example could be for a specific type of person. So somebody who's having pubic symphysis pain, who let's say has been like relatively inactive during pregnancy for whatever reason, or maybe even before pregnancy, we're starting pretty gently and we're keeping those parallel positions in mind. So that person may start with doing like seated glute squeezes and seated transverse abdominis, just belly braces with 10-second holds. Like for some people, their pain is so flared that is truly where we start. For other people, maybe they've also been inactive during pregnancy, but their pain isn't as intense. They can tolerate a little bit more. We might be starting with glute bridges, right? And on their back, just raising their hips up. And maybe starting with like on all fours doing belly braces, or on all fours doing belly braces with arm lifts, right? Like still really gentle. And then of course that scales. Some people will be fine if you just say don't lunge, do squats, and don't plank on the ground, plank on an elevated surface or on knees. You know, like this is infinitely scalable, but we really want to start introducing strength to glutes, to abdominals, and your pelvic floor will get stronger along the way if you have decent coordination there.
Mm-hmm. Wonderful. Okay. I love it. Okay. Let's move along then to anything else on pubic symphysis before we move on.
I don't think so. I could talk about SPD all day, but I feel like we covered our bases.
Okay. Sounds good. Now let's get into discomfort related to, okay, I say diastasis, recti.
Tomato. I really don't know. I say diastasis. There is no correct.
Beautiful. Okay, cool. So we'll say diastasis today.
Great.
So let's get into discomfort related to diastasis, recti. But first, for the sake of being thorough, go ahead and explain briefly what that even means.
Yeah. So the full name is Diastasis recti abdominis, which occurs not just during pregnancy, but pregnancy is probably the most well-known time that somebody can develop a diastasis recti abdominis, which we can call diastasis for short. And what it is your rectus abdominis, your six-pack muscles, which like anybody can visualize because we know what a six-pack looks like. They go up and down from your rib cage to your pubic bone. They're two muscles. You have a right and a left one. And as your belly grows, the fascia that connects the two of them to each other gets thinner and wider to accommodate space for baby. It happens in 100% of pregnancies by the end of a full-term pregnancy because the baby's got to grow, right? Like it has to go somewhere.
Need some room.
Right. So it's typically called a gap, but it's not a tear. It's just a widening and a thinning of the tissue that connects those two muscles.
Cool. Amazing. And is that always uncomfortable for women?
It's not. So there are a lot of programs out there that are like, heal your gap. We need to fix this. And I think that it's doing pregnant people a big disservice because it is actually a normal structural change that happens as a result of growing a baby. Like our bodies will change as a result of growing a baby, but it's not dysfunctional. Like it is intentionally it's not intentionally, but it is like evolutionary functional. We need that give in our bodies to be able to make space for baby without creating compression on our spine. Like it is the optimal method of growth. So this isn't something that needs to be fixed because it's not in all people, because it's not something that causes weakness or discomfort or symptoms in all people.
Amazing. Yeah. So what discomfort might they experience as these changes are occurring? What might indicate that the discomfort they're feeling is related to that change that's happening?
Yeah, so any sort of like sensitivity, pain around midline in the abdomen, around your belly button is a sign that your symptoms are maybe related to that separation or that weakening in the tissue. And anybody who's describing feeling weakness in their core, like I can't feel my core, people will say, and that's not necessarily a sign of diastasis recti. That could just be a sign of abdominal changes during pregnancy, but they tend to go hand in hand. But the biggest like true symptom associated with diastasis is sensitivity in midline. Evidence has largely indicated that while we used to believe urinary incontinence and prolapse and back pain were related to diastasis, more and more data is coming out that seems to be suggesting that's not true. People may have a diastasis because I don't want to misquote the statistic. At 3 months, I think it's like 60% of people will have one. At 6 months, I want to say it's 30%, right? Like if 30% of people have a lasting diastasis and about 50% of people have urinary incontinence, like there's overlap. But is the diastasis
not
the reason?
Causality.
Yeah, causality versus is it correlation or is it causation?
Mm-hmm.
So when I see somebody in my clinic who is coming in for leakage or heaviness and they have a diastasis recti, we are treating them for core strengthening because core strengthening supports your pelvic floor, which helps address symptoms. And sometimes the diastasis, the separation will get narrower or shallower, or they'll just have better coordination. But it's not uncommon. But it's certainly not everybody who has true diastasis related symptoms and dysfunction.
Yeah, interesting. So what I'm hearing is that in strengthening the core, we may see a decrease in the diastasis. We may see that tissue moving, but that's A, not necessarily the goal, and B, not necessarily like what is directly contributing to whatever symptom they're experiencing changing.
Yeah.
It's kind of a piece of the puzzle that also moves.
Yeah, exactly. I mean, yeah. And
I guess another way of saying that would be like, it's very possible to have like really good function with a separation. Like,
yeah.
And you have some distance there, but it doesn't necessarily.
It doesn't necessarily mean much.
Yeah. Or that you're going to have symptoms.
I forget who said it, but somebody smarter than me said aesthetics don't equal athletics. And diastasis I like it too. A diastasis is a really good example of that. You may have a visible separation between your rectus abdominis. You may have coning and doming, and you may be extremely strong and extremely functional. Or you may have absolutely no separation. Your rectus abdominis might be kissing in the middle of your belly, and you might be really weak and have pretty poor function. So it's not enough information for us. Anthony Lowe is a physiotherapist out of Australia. Do you know who he is?
Yeah, I did his course.
Okay, so you know him.
Yeah.
He's amazing. And did you do the Doing Diastasis Differently course?
No, I did the, I think it was the female athlete course.
Okay, yeah. So I wonder if he talked about this in your course, but what he talked about in the one that I took was diastasis recti is this wildly, I mean, we know this, it's this wildly overpathologized condition. Why is it overly pathologized? Because there is an aesthetic component and we can sell people on aesthetic change. And additionally, when you look from a healthcare standpoint, and this was him just like posing ideas, like this is just like him, but he was like, if we have a pathology and a diagnosis, all of a sudden the operations to correct these aesthetics become medical necessity because they're correcting a diagnosis. Like, how much of this is just like our medical complex coming together with our socialization that women want flat stomachs?
Amen. Yeah.
So I will get off of my soapbox because
I love your soapbox. No, it's true. When I was like deep into my CrossFit season of life through my 20s, I trained under a really great coach. He had a good head on his shoulders, great guy. And something he used to say was, some train for show, we train for go. And I loved that outlook throughout that time of my life. I think I got lucky with where I was. I was in a setting that was really focused on like our capacity, our athleticism, our strength, what are we building, and not on the aesthetic of what we were doing. And yeah, and I think that there's so much value to that across the board. And it's unfortunate that it's so easy. It's such a slippery slope for anything that falls into the aesthetic realm to just be kind of like wisped up into the wave of we can easily sell this because it's also aesthetic, and then it turns into some kind of an idea that isn't really true.
Yeah. And I mean, diastasis, I think more than all of the other postpartum conditions is like, it's just like so deeply tied into our body image and like societal expectations on the female body.
Amen. Yeah, which is, I mean, obviously totally okay to care about what your body looks like. Yeah, but not necessarily directly related to the symptoms of other things.
It's just important to understand the difference, right? Like to understand what's what. We can care about how we look, we can care about like appearance, and also not confound the fact that that doesn't mean it's a medical diagnosis.
100%. So let's get into what would be perhaps medically concerning about diastasis, or what symptoms might be worth paying attention to if women are experiencing them.
Yeah, it's funny. Like we can talk about, like we talked about how, for a lot of people this isn't an issue, but there are still signs and symptoms that you can look out for that might mean that you do want to strengthen your core, because that is at the end of the day what helps make a diastasis recti more or less significant, whether that's wider or shallower or narrower, right? So some signs that I look out for, I assess everybody for diastasis recti when I see them postpartum, because it's like a 2-minute assessment, and why not? Why not get a better idea of how your core is looking postpartum? So some signs that this is something that might be affecting you, aside from tenderness in the abdomen, feeling like you're not connected to your core, feeling weak. Another one that I hear that's like, this is related to diastasis, but really just related to abdominal weakness postpartum, is like, I've been doing core strengthening and I'm not getting any results. Like usually that means that you're not accessing your abdominal muscles effectively. So you're putting in all this time and effort and you're not getting the results.
Can you explain what you mean by not accessing them?
Yeah, bodies are really smart. And so if you're trying to do a movement, your body will use the muscle that's the strongest and requires the least effort to perform that movement. So if like a deadlift is a perfect example. Depending on how you move, it can be more glute, it can be more hamstring, right? Or like a press, a strict press versus a push press. Like if my shoulders are weak, I will just innately go to a push press because it's the only way my body will be able to achieve the task without causing me pain. So the same way, if you're working your core out, but your body's being smart and your deep abdominal muscles are weak, you're going to be using the strong ones and the strong ones will keep getting stronger, but the weak ones won't get strong.
Cool. Beautiful. Okay, that makes sense. Yeah. The way that I kind of think about this, and tell me if this is accurate or not, is I think about like the brain muscle connection, like the neuromuscular connection, and that the signal isn't like communicating as efficiently, that like the the work is being sent elsewhere, I guess is my other way of thinking about it. Like what's more efficient does the task. And
Yeah, I mean,
the muscle
that's
that's not tuning in is just like, we don't want to.
yeah, that is the scientific reason why bodies are smart, right? Like they're going to use the one that has the best mind-body connection, the best neuromuscular control and signals, because why wouldn't it? Because we like to conserve energy because we're smart.
We're so smart.
We're so smart.
We're so smart. We're so efficient.
Very efficient. It is actually smart, right? It just sometimes keeps us from achieving the goal.
Yeah. Beautiful. Okay. So when you're saying that they're like, I'm doing core work, but I'm not achieving any result, it is likely because of that.
Oftentimes, yes, particularly postpartum, but probably outside of just postpartum.
Beautiful. Okay, cool. So then where does that take us next?
So I think I was talking like what we're looking for. So if somebody is working out, how they are coordinating movement really matters. Coning and doming are the two things that people know the most about, or hear, I think, the most about when it comes to diastasis. So whether their abdomen is changing shape as they're doing a movement, whether they're noticing like a shark fin down the center of their belly, whether they notice that their abdominals are kind of like poofing out rather than drawing in to support their spine when they're doing a movement. So if you're noticing that you're exercising and you're not able to maintain strength through the core, or you're noticing pooching, or you're noticing kind of like a change in shape that looks like a dome or a peak down the center of your abdomen, those are signs that we at least want to be mindful that your muscles might not be optimally coordinated. Those things might be okay for you, but that at least to me is like, it's a yellow flag of, I want to know.
Mm-hmm. Okay, got it. So if someone notices that's happening, it's not necessarily that they are going to be experiencing like a lot of pain. So like if we're talking about diastasis in the context of like aches and pains during pregnancy, it doesn't sound like it's super common for that to be like a really strong pain point for women of like, oh, I'm so uncomfortable because my diastasis is moving.
No. Yeah, it's not. They might think it, but it's unlike, okay, pubic symphysis pain or round ligament pain, like those structures are actually the reason why you're in pain, right? Something going on to that structure is hurting you. Your diastasis isn't the structure that's hurting you. The weakness around the muscles is probably hurting you, right? Like having a weak core, having weak abdominals might cause back pain, might contribute to leakage, might contribute to prolapse, but it's the weakness, it's not the structural change. Versus with those other two conditions, it's actually the structure that's being stressed that's causing the pain.
Got it. Amazing. Okay. So when we're talking about any like related discomfort during pregnancy, it's more of it's not really related directly to the diastasis.
It's related to the fact that your abdominals are being strained as your baby gets bigger, so they're getting weaker and more fatigued. So what we really need to do is keep you strong. Like, people need strength through pregnancy because pregnancy is so hard on the body, and yet we conventionally believe that pregnant people should be really careful and shouldn't move. And so you're putting these people into a state where they're working way harder just by virtue of existing, and you're telling them to be cautious all the time. Like, I went home for my baby shower when I was like maybe 30 weeks pregnant, maybe 25 weeks pregnant. It was pretty earlier than a normal baby shower. And I remember I went to move a chair. Like, I was at the gym all the time. I was lifting pretty heavy through my pregnancy, heavy for me. And I went to like pick up and move a chair, and my friend ran up to me and like ripped it out of my hands and was like, "What are you doing?" And I was like, "Absolutely nothing problematic." Most people don't have the confidence or even the knowledge to like really push back on the people that they love and trust, telling them to be careful.
Right, 100%. And I mean, I see that all the time in my work of working with women on strength throughout pregnancy is they do come in oftentimes very wary and very cautious.
Yeah.
And I think I really appreciate the work that you do about bringing women up to speed of like, no, we want to stay very strong through this season, and you are capable of so much during this time, and it serves you well to stay doing things to maintain your strength or build strength in these ways during pregnancy, because you're going to be lifting some shit up after pregnancy. We're not doing things.
Car seats are heavy.
Amen. Babies are heavy. They just get heavier, man.
I know. They just keep getting heavier. Yeah, for sure. I mean, so talking about diastasis, it turns into this like winding road, but it's a structural change that is normal, right? We expect it to happen. It's often associated with abdominal weakness, which is the true concern. And strengthening is the solution. It's not going to prevent somebody from developing one, and it's not always going to close the gap for people, because whether or not a gap closes has more to do with your genetics than it has to do with anything you have control over. But regardless, if you're seeing a change in tissue shape, you're struggling to access your core, you're having back pain, leakage, prolapse symptoms, abdominal sensitivity, then strengthening your core is likely part of the solution, which may or may not help narrow or shallow that gap. I hope that's like my attempt at a summary.
That's a beautiful summary. I think you wrapped that up very nicely. It all comes back to strength. It all comes back to strengthening. Beautiful. Okay, let's pivot now. Let's go ahead and take it into sciatica.
Yeah.
Yeah, I've got sciatica and I've got SI, sacroiliac joint pain. To me, these ones, I would love for you to distinguish the two.
Yeah, I think that sounds great. They're a good one to talk about together because they get confused for each other.
They do.
All the time. Yeah. I mean, everybody. It's like, as a PT, I've been wrong many times. Yeah, so where do you want to start?
Let's start with, I like starting with the symptoms of identifying, like, if you might be experiencing them.
Yeah. So true SI joint pain, sacroiliac joint pain, is pain at the sacroiliac joint, which if you think about the pelvis again, which we talked about for pubic symphysis pain, right? Your pubic symphysis is a joint where the front of the pelvis comes together. Your SI joint is the joint where the hip bone meets the sacrum in the back. So you have two. You have a right and a left one because you have two hip bones that both attach into the sacrum. So if you know where that like divot is in your low back, that's your SI joint.
Cute.
Right? Yeah, the cute little dimple. So you can touch it.
Dimple.
So if your pain is right there. The SI
joint's kind of sexy. The SI joint's kind of sexual.
It's it's like a little sensual joint, you know?
Okay, I like it.
The best way to know that somebody's having SI joint
is if they look really hot while they're in pain.
Is that they point to their SI joint.
That helps. Yeah, that makes sense.
So you're like, it hurts here. And you're like, okay, that's your SI joint. Yeah. Thank you for telling me.
Okay.
But it can refer, like your SI joint, this is where it starts to get kind of tricky. Is it SI or is it sciatic? So sharp stabby pain in that back dimple, that's your SI. Typically happens doing similar things to pubic symphysis pain. Lunges, getting in and out of the car. But it can also happen with like sitting for too long, being in a static position, being in bed. So postpartum, it can be kind of a pain in the ass because you're sitting in that same position. Sitting cross-legged can really piss it off. Same with pubic symphysis pain. That was one I forgot. So that's SI joint pain. It can refer, though, down into, like, the glute, down into the top of the back of the leg. Like, it can refer down the stem leg. Yeah. Versus sciatica. And the thing I should say about SI joint pain is it, similar to pubic symphysis pain, can be sharp, stabby, and then can just be, like, pissed off for a while.
So it can be, like, dull, achy, sticks around.
It can hang around.
Whereas the round ligament pain is like, boom, stab, I'm gone. Okay, and then the pubic symphysis, it's sharp, stabby, and can also be dull, achy.
Yeah, pubic symphysis pain and SI joint pain, I think of them as like siblings because they're on two sides of the pelvis and they act kind of similar.
Amazing. Okay, I like that. Love a good metaphor. They're siblings.
Yes. Versus sciatica is burning, achy pain in the glute, down the back of the thigh, can go into the calf and the foot.
Got it. So that's the one that shoots. That one refers.
Can shoot all the way down. Sometimes people will come in and they'll be like, my calf hurts. Like that's their only symptom. And that can be sciatica. Because sciatica is an irritation of the sciatic nerve, which goes all the way down those structures. So you can have pain the whole way or part of the way. And that is the difference between sciatica and SI joint pain. They can kind of show up in overlapping places, but they are different.
Amazing. Okay. Perfect. So let's talk first about sciatica then.
So we already said kind of like pain all the way down that leg for some people, foot, calf, back, hip. Usually irritation along that nerve. So what we want to do is we want to be mindful of whatever triggers the pain. So for some people that can be like leaning over to touch their toes can be really irritating. Being in too much of a hip hinge because you're stretching that nerve. So we sometimes need to relax the tissues that go down along the back of the leg, maybe foam roll the calf, foam roll the glute. We need to do some mobility exercises along the lumbar spine because that's where that sciatic nerve begins. So we improve mobility in the segments where the nerve leaves, and that helps decrease how pissed off that nerve is, which helps decrease pain. So sciatica is a lot about how do we calm this nerve down. There are nerve glides that can be done that are really hard to teach in a podcast, but I'm sure you can look up sciatic nerve glides. If you do those, the goal is for it to be entirely pain-free. Like, you should not be feeling much of anything while doing them. But what you're looking at is nerves like space and they like movement. So how do we reduce compression on the nerve, and how do we introduce pain-free movement on the nerve to make it happier, to make you happier?
Amazing. Okay, so sciatica is caused by pressure on the nerve. The nerve is compressed, and we're trying to find ways to decrease that pressure, give it space. And that can be by helping the muscles relax, letting them kind of release a bit and give a little bit more space up along the line. And that can also be done through nerve glides, which should be pain-free when you're doing them. Do the same thing. We're trying to encourage the nerve to have more space.
Yeah.
Live its little life.
Yes, exactly. To live its best little life. And if you think that you're having the third piece for sciatica that you can consider at home is, do you have any consistent movement pattern that has you doing the same funky thing over and over again? Like, do you always sit with your right leg crossed over your right or your left? Because that's going to tug on that nerve. And for most of us, it doesn't matter. But for some of us, it creates sciatic nerve pain. So can you identify these asymmetrical patterns that you fall into all the time and start doing something differently?
Cool. When you say do something differently, are you trying to introduce more symmetry? So if I notice, like, I'm always crossing my left over right, would I then make an effort to sometimes cross my right over left, or maybe cross at the ankle, or just sit differently?
It's really said differently. Like, there's no bad position. We want your body to be comfortable in all of them. And bodies like to fidget more than they like doing any one thing in particular. So introducing symmetry is good for certain reasons. Like, I'm not going to say no to that. Yeah, totally. Try it. Try sitting in a way that feels funky for you, because that's great for your brain.
Yeah.
Right. But really, like, it's just do something different. Put your feet down together, cross the opposite leg, stand up, like, get into a different position.
So we're not necessarily trying to be like, oh my gosh, I noticed that when I stand, I pop my hip to the left and whatever. Now I need to make sure that I'm hitting a 50-50 split. And I sometimes stand the other way. I think we sometimes fall into this trap of like that there's like one perfect right way to do it. Or there's like, once I identify that I'm like doing it this way, I need to create like exact symmetry. But it's not that. It's just kind of notice and create some change around what you notice is your default.
Exactly.
Okay, disrupt the default mode.
Exactly. That's it. Do something that feels funky.
Beautiful. And just isn't that the objective anyway? Okay, fun fact, quick mini story from when I was a child. When I was really little, I went through like a symmetry phase where I was like pretty geeked on like making sure things felt symmetrical across my body. So like if I was walking down the hall and like my arm brushed like a doorknob, I would like turn and make sure I brushed on the other side, you know? Or like if my dog licked me, I'd like make the dog lick in the same spot on the other side.
Kids are such weirdos.
Oh my gosh, our little brains are so wild when we're little.
Now that I'm a parent, I'm like, are you just being a weirdo? Like, are you just being a kid, or should I worry? All the time.
They're fascinating little creatures.
Truly.
Yeah, we've got a lot to learn from their little default state, right?
That is so funny.
What do you know that we don't? Okay.
So much.
So much. You're tuned in, man. Okay, now let's talk about SI joint pain.
Yeah.
That pain in the cute little sexy dimple, sharp, stabby, sometimes dull, achy, sometimes sticks around. What's going on? What can we do?
Yeah, I mean, it really is like, think everything I said for pubic symphysis pain, superimpose it onto SI joint pain for the most part with some key differences. So can be tension related, can be weakness related, can be related to funky asymmetrical movement patterns, right? Those are the three kind of like biggest ticket items that I think about for SI joint pain. Usually we want to address the tightness, but in this case, instead of pelvic floor and adductors, we're thinking more like glute, hamstring, but honestly, sometimes also adductors and pelvic floor. So we're just incorporating the back chain.
Okay.
So foam roll your glutes. Use the lacrosse ball at the glute against a wall. That's how we calm down tension. We want to, again, avoid in the short term the things that really flare that pain and make it really act up. And then start introducing strengthening in your core and your glutes and single leg stability to help calm that SI joint pain back down. People with SI joint pain sometimes will also have more discomfort sitting. So they sometimes need to sit at like a higher surface so that they're not as flexed into their hip when they're sitting. That can be less uncomfortable too, just from a pain management standpoint. But the management is relatively similar to pubic symphysis pain. Some people feel really good in an SI joint belt is the only additional piece. So you take a belt, one way to test this is like take a really thick scarf, tie it really, really tight around your hips, not like your waist, truly like your hips, like low, low, low.
Around the belt.
Yeah, like where those really low rise jeans were of our youth, the terrible ones. Like tie it low.
Don't even bring them up.
They're so rude. I went home to Pennsylvania a couple weeks ago and I had some of my old like college clothing there and I tried on the pants and I was like, why did I ever do this to myself? This is cruelty.
So cruel.
Violence.
Brutal.
But tie your SI joint pain or your SI belt there, your scarf there, and then do the movement that typically bothers you and see if some of that external support feels good. That's pretty good of a tell that it is really your SI joint that's bothering you. B, you can use an SI belt to calm down pain if it's really bothering you. And 3 tells us that what you really need is stability. So we need to strengthen your core, strengthen your glutes, strengthen everything around that joint.
Beautiful. Okay, so the SI belt can be a helpful tool to relieve symptoms.
Yeah.
And identify, something beneficial in the longer term is going to be to build strength and stability here. But what I assume what we don't want to do is just say, cool, I figured out that the SI belt helps. I'm just going to throw that on and run amok.
During pregnancy,
that's an option.
Yeah, it's an option,
but it's not necessarily going to adjust the root cause. Yeah. It's a tool, but it's not necessarily a fix.
Yeah, yes. Obviously, as movement professionals, we would love for somebody to get stronger.
Yes, we like that.
Yeah.
But it's also an available tool to manage symptoms throughout. And then is SI pain during pregnancy likely to go away after?
Anecdotally, SI pain can be a lingerer. Like, I think if it's really severe, yes, again, same with pubic symphysis pain, like baby no longer in body under a lot less stress, severity of pain tends to reduce. The SI joint pain is like, it's a real pain in the ass. It can be real funky. It can be really stubborn. It can take a while to calm it down. That's why I tend to tell people with pubic symphysis pain and SI joint pain, like the sooner we can get to it, the better. Because as soon as it becomes chronic, like we get into like kind of like a fist fight with it for a while.
Then it gets really stubborn.
Yeah. It can. Yeah. I mean, people do tend to reach a point if they have that really stubborn SI joint pain where they're like, yes, it's really annoying. I know what to avoid though. Like they live their lives. They're doing well for the most part. It's just that it's like a nuisance.
It's a pain.
Yeah.
Beautiful. Fantastic. We covered so much. I appreciate you. Yeah. Okay. Those are all of the ones that I had on the docket. Is there anything else that comes to mind for you? Anything you feel like we didn't quite get into that you want to make sure we hit?
Honestly, I think that this is like so much to go through in one episode. I think this was amazing.
You really nailed it very concisely.
Thank you so much for not calling out the fact that it felt very long-winded.
Oh my gosh, no, it was so good. We covered so much and it's only been an hour and 10 minutes. It's really not that long for everything we got through. Yeah. No, absolutely nailed it. For me personally, I feel like the only spot where we got a little circly was diastasis. But, there's a conversation to be had.
It's a circly topic.
No, it's a circly topic. Yeah. No, I think it's totally fine. So, no, that's so good. So my general understanding of kind of the top view is with whatever ones of these are going on, A, there is relief available. B, doing core strengthening and building strength and also doing things to release tension, maybe in the adductors, etc., is going to be probably positively beneficial. And there is hope. Those are my top view conclusions.
Yeah, I mean, I think that's it. Stretch, strengthen, move in ways that feel good, and that usually helps.
Beautiful. Okay, sounds good. So when I wrap up interviews, I ask everyone a couple of the same questions. So now I'll ask the ones just for fun. And the first one is, do you have a mantra If so, what is it?
80% is good enough.
Oh, I like that. Okay.
I had a business coach once that I really did not enjoy working with, and he said that, and it's like I've always said that it was worth the experience because it's so good.
That's so good. I had a similar experience once where I worked with a coach, and like on the grand whole, I was kind of like, that wasn't the right fit for me, but there were a couple really valuable things that I took away that I was like, well, what are you gonna do?
Yeah.
Yeah, can't argue with the couple really valuable things that I took away from there. So
Right.
solid, cool. All right. Can you tell us about a time in your life or an experience that you had that was particularly empowering for you?
I feel like I should have a clear answer for this one. You know what? This is a really kind of funny one, but right at the beginning of my PT career, when I realized that a traditional PT setting was going to be the death of my soul and that I needed to do something different, I was like, I really love writing. I really love educating people on how pelvic conditions are normal. They can get better. Like, they don't need to suffer in silence. I'm just going to reach out to a couple magazines and see if they would be interested. Like Women's Health Magazine, health.com was another one. Just see if they would be interested in having me write an article. I'm sure they're not. I'm not a writer. So I sent an email into the ether and got like 2 responses in 10 minutes. And I was talking to my husband that night and I was like, did you know that if you just ask people, sometimes they say yes? Did you know that? And he was like, he had like real dude energy. He was like, yeah, I did. I did know that.
The dude energy is so true.
And
like, yeah, I just always assume people are probably going to say yes.
I do not. That like really changed my life.
That's amazing. Yeah. I love that. It's, so did you end up writing the articles?
Yeah, I did. They're still on our website.
That's amazing.
I know.
Yeah.
It was wild.
That's great. No, I think that's good timing for me. I'm glad to have heard that story right now.
Oh, great. I love that.
Yeah, so thank you. All right. Well, how can our people find you if they're listening and they're like, man, I want to work with her?
Yeah, I'm easy to find. Ladybird PT is our Instagram. Ladybirdpt.com is our website. And you can email me directly if you'd like at Rebecca@ladybirdt.com.
Okay, for our listeners, I'll make sure all of that is in the show notes for you guys. If you guys have any questions for us, please don't hesitate to reach out. You can reach out to me on the Instagram or at my email, or you can reach out to Dr. Rebecca at her contact. I'll make sure it's there. Anything going on for you right now that they should know about?
We have a free workout coming up June 10th called Strong Where It Matters, which is specifically meant for people with pelvic floor dysfunction and symptoms that are pregnant or postpartum. So if you're having any of the things that we talked about today and you're in Austin in June, come work out with our clinic director, who's just going to be giving helpful kind of movement modification recommendations for people experiencing symptoms.
Okay, what time of day is that?
Ooh, don't quote me. 9 a.m., I think.
9 a.m. ? Okay, great. And what day of the week is June 10th?
Also a great question.
I'm asking you really hard questions. I know, I'm so sorry.
Tuesday?
It's a Tuesday?
Nice.
Tuesday. Okay, amazing. Is that something you guys are going to keep doing?
Yeah, so as part of our spring series, we're going to do a fall series. So in the fall, we'll be back with a core confidence workout that's meant for people who are worried about diastasis, just learn how to get stronger in their core. We'll do a birth ready workout. It's all about mobility for fetal positioning. And then we have a third one that I can't remember.
Cool. Amazing. Okay, that's so good. Because I'm not sure if this episode is going to be out before. It's not going to be out.
We'll be back in the fall.
I'm so sorry. They did like a really cool workout on June 10th that they're going to bring back in the fall.
It was amazing. It was so good. We're going to do it again.
It was so cool on June 10th, which was now in the past. But cool. All right. I'll make sure that they have access to that too. So beautiful. All right. Thank you so much. I appreciate it. For our listeners, let us know if you need us. Rebecca, thank you so much.
Thank you so much for having me, Stacey. This was amazing.
It was so good. All right. Adios.